I and my party welcome the continued relaxation of the COVID regulations here in Wales. With COVID-19 numbers at a record low, all nations of the United Kingdom have moved away from lockdowns and towards a reopening of our economy as we recover from the coronavirus pandemic. The people of Wales and in my constituency in Brecon and Radnorshire have made huge sacrifices to ensure the damage of COVID was limited as much as possible to protect our communities and the most vulnerable people in our society. They spent months in lockdown, not seeing loved ones and unable to live the lives they had worked so hard to build. Thankfully, because of the UK Government's vaccination programme successfully being rolled out across all 4 nations, we are seeing people's liberties being restored, and I must commend the Welsh NHS and my own Powers Teaching Health Board for the great rollout of the vaccination programme, which has enabled us to be in the position we are now. However, governments of all colours must be very careful before trying to take these freedoms from the people of this country again. I was pleased to hear my fellow MS Russell George raising the points earlier about the reopening of the hospitality sector. It's vital that our businesses are now given the freedom they need to trade successfully. Overzealous regulations will impede these businesses from being able to achieve the sales and trade they need in order to create wealth and pay taxes we vitally need to fund our public services and our NHS. An area of great concern for me and many at present is the state of the nation's mental health. Many people have suffered from isolation over the past year, with lockdowns playing a significant role in the deterioration of people's physical and mental health. And most of those people have been left to suffer in silence, with no support or big delays in backlogs in the support for those people who have had the courage to ask for help. Suicide rates in Wales were rising even before the pandemic, and they've continued to do so. Men make up 75% of suicide victims in Wales, although I am sure that the Welsh Government took significant time to consider the potential rise in suicide before they brought in their COVID regulations last year. I wonder if the Minister could outline how she and the Deputy Minister for Mental Health intend to tackle this huge problem in Wales. Your government has promised to increase support for those suffering with mental health-related illnesses, but surely the Welsh Government would have considered the impact on people's mental health before they brought in COVID regulations early last year, and would have been told this by the medical and scientific advisers that there would be a huge spike if lockdowns were continued to be imposed. So can you tell me, Minister, what additional support has currently been given to support those suffering with mental health? And finally, Minister, in your closing remarks, perhaps you can outline how you and your government will ensure that if we were ever to bring back any new regulations, that people's mental health would be a top priority, as any decisions on future lockdowns and fire breaks could make the current mental health crisis in Wales worse. Diolch Llywedd.
Hyw'r Anca Davies.
And could I concur with the points that have just been made about